Good morning. I am Dr. Medcyivf, MEDCY Hospital, Vijayawada. Today I am talking about one of the most common gynecological problems women have, and that is fibroid. People, when we say there is a fibroid, they ask us what it means. When we say it is a lump in the uterus, their mind immediately jumps to a cancer. But the first thing that we need to remember is fibroids are not cancerous. Rarely 1 in 350 people who have a lump looking like a fibroid will be a cancer. But most of them are not cancerous, they don't turn into cancer. So let's delve into what a fibroid means. Normally, every woman has a uterus, has a lining inside the uterus called the endometrium. The purpose of this lining is, if there is ovulation, a oocyte release, if there is a male partner, sperm swim in and come, if there is fertilization, a growing baby in the tube is sent into the uterine cavity, and this endometrial lining gets ready for that. The preparation of the endometrium starts with the beginning of follicle growth, and the baby can stick inside this endometrial cavity, and after 9 months of development, a competent individual comes. So what happens in the uterine cavity is, once there is a baby here, this baby and the endometrium together will form a unit called the placenta. This is an organ system that is exclusively formed for providing nutrition, water, oxygen to the baby, so that the baby can continue to grow for 9 months, and whatever waste material this baby makes goes through the umbilical cord, through the placenta into the mother's blood. So a uterus that is normally this big in size, to accommodate a growing baby, grows to this bigger size. So for that growth, it is not possible just to stretch it to that level, because the uterus muscle, although it is thick, it has a capacity to stretch. It needs to increase in number to accommodate a growing baby of 9 months. So there are cells that are stem cells that are in the resting phase, and when there is a pregnancy, when there are hormones and growth factors of pregnancy, these stem cells are activated to make more muscle so that the uterus becomes this size. Normally these are under braking system so that they don't move forward. Unfortunately, we are being exposed to large number of hormones. Overall, almost 50% of the women living in urban areas are overweight. We are having a lot of changes in our hormones, and in the food additives and chemicals that are coming into our diet, they are behaving like hormones. Because of all these, the system that is supposed to prevent the cell from getting activated, this brake is failing. So once the brakes fail, some cells get activated prematurely. They were supposed to get activated in pregnancy, but even without a pregnancy they are getting activated and they are growing. And that growth in the uterine muscle is called a fibroid. So what happens when people have fibroids? If there are large number of fibroids, the uterus increases in size. Or if the fibroid is projecting into the endometrial cavity, it will cause a lot of bleeding. If the fibroids grow forward, they are going to exert a pressure on the urinary bladder, so there will be problems with urinary bladder. There will be frequency. Sometimes the fibroids grow back and they will be having a pressure on the rectum, so there is constipation. Uterus becomes very big. Every menstrual cycle it contracts, trying to push out the blood. So then more amount of blood loss is there, and because of the contraction, these fibroids also being compressed, there can be a lot of pain. And in people who are planning fertility, because the uterus is the place where a baby should grow, if there are fibroids, some of them can interfere with a pregnancy, some of them can cause a tubal block. In pregnancy, 1/3 of these fibroids can grow, and if they outstrip the blood supply that they are having, there can be some degenerative changes and there can be severe pain. They can cause an obstruction when the delivery is there. They can cause bleeding after the baby is born. So they are always associated with complications in some women. So not all fibroids will cause trouble, but symptomatic fibroids need treatment. Nowadays we have so many treatment options, and those need to be explored depending upon what is the age of the women, what is the size of the fibroid, how fast are they going, how much is the blood supply, where are they causing trouble, how far away is menopause, and how much they need their uterus to be in place. Some of them we are nowadays seeing women having fibroids even before they have completed their family. So in those people we need to conserve the uterus. So you need to talk to your doctor about your requirements and plan your treatment protocol.